Hello. Hey, how's it going? My name is Dr. Wu. I'm a doctor of physical therapy, and my background is a trauma surgeon in China. And my topic is talking about a question that I keep getting, and also combine my experience of my patients report the history of what's going on to their neck, more specific, and also my personal experience of what I noticed and how I observe things. And hopefully, you will benefit from this topic and understand what's going on and where and how to handle the situation. And maybe prepare you a little bit better next time when you talk to your family doctor, or when you make the decision in terms of whether or not you should get a surgery or whether or not you should get more aggressive treatment, such as surgery. Okay. Now, a lot of people having trouble of the neck, and so then they go to a primary doctor and say they have the neck pain, and more discomfort might come from that, including the shoulder discomfort, in your hands, and the numbness, tinglings, discomfort. So here's what I want to share with you. So I have a patient. He's a physician, but doing other mainly focused on research. But he's still a physician and treat patients, but not orthopedic aspect, not a rehab aspect. So basically, what he told me is that he traveled for about 15 hours of flight, okay, internationally, and then he had to deal with the bump in the in the airline. When you have the turbulence in the air, and also rent a car and drive. And then if you're getting used to one type of car, either it's low or it's tall, and all of a sudden you have this high, either relatively tall, high like SUV, or you change it into this convertible, very low, and then or maybe just the steering wheel is a little bit too low or it's too high, or you have to adjust the chair, but the chair is too much forward, and then the back support or the neck support there or head support there is too much tilting forward, and you kind of hit the head. And so there's more discomfort might come from there. Okay. Now, if that's the case, and then you know what I'm saying. So what happened to this doctor is he basically for this 15 hours on the airline, and have to deal with a lot of positioning changing, and have to sleep like this, and as if you fell into sleep, and then you were landing, and you might hit like this, and then extend it, and so that's the whiplash. Okay, so that's the whiplash, and then they hit it, and then causes the discomfort, and then the muscle starts to spasm, or the neck here, because of the facet joint, which is the joint right next to our neck bone. So we have 7 bones on the neck, and one of that on the right, on the left, and both sides of that, and then might hit those conditions together. So it might get a little bit of abrasion, like you're doing like this. So your left side here might have more chance to loading into it. As you see that there's a 2 point here, like my finger here, okay? So if one side is being hit more, the other side has less, then more stress can go into it. And then you have this side shift, left and right and forward and backward movement like that. And all that is going to have that trouble. Okay, so that is the what I say is that try to avoid those discomfort by different strategies. And today we're going to talk about it. And so in terms of that doctor, with the neck pain, spasm of the neck and the shoulder, constant numbness in the hand, and unable to reaching and lifting, unable to put your hand over the head and do the wash the hair, or do the movement like this, or wash the face. So all that is difficult. And when it's difficult to do that, and it's very limited, and because of that, the shoulder kind of need to move. For example, if I turn my head to my right side, I can very easy to check But if you cannot do that, well, because of neck discomfort, then you might turn your body using the trunk. When you're using the trunk and to compensate, you are asking the shoulder and upper back to twist and rotate more. Okay, and so that's another thing. And long story short, then for this doctor, after treatment for several weeks, and then the spasm decrease, and then the pain decrease, then the numbness go away in about 6 weeks ish, and then after that we work on really build up the muscles, and at about 8 to 10 weeks, then the deep neck flexors can do a better job of holding in a position. We call it the supine neck flexors test for more than 20 seconds holding. Anyway, so he got better, and then he asked me like, why this happened and what can I do? So I would recommend really having those like a support, like a collar support like this, and to avoid too much tilting, avoid too much rotation and extension, and avoid the whiplash. And strongly recommend when you take off, especially for kids also, or when you land it, when the airline landed, you need to make sure that you protect your neck by tucking the chin down, and then retract it a bit, okay? And then you're really using the shoulders down, shoulders back over there. So that would maintain. And then also you need to lean it backward. So all these things is going to be your neck, your head, your upper back is going to support it by the chair. And that's how you can improve from there, because you want to have that the push from the airline, or when the airline landed on the ground. You don't want to have that part to hit it. We don't want to have that whiplash movement over there. Okay. Now, and so that is one story of my clients, and I help him to get rid of the numbness, to get rid of the pain, and able to do the movement freely in the left and right side, and then reaching to the high shelf without discomfort at all. Now, this is a successful case, and then other cases that sometimes they went through they go to other places and cannot fix their numbness tingling, or they just want to avoid the surgery. Okay, people will ask me like, my doctor want me really coming open and work on my neck, or work on the thoracic outlet over here, which is we call it impingement syndrome. It means that the nerve you travel all the way down, and it goes through this part here down. Okay, and then there's a bone here, and there's a muscle. It's like in my fingers. So I'm gonna put my pen over here. So it's like this. So the muscles like my finger, and the nerve actually is travel. It's like this pencil or this pen. So the pen, the nerve is travel down. If this one is tight, it's gonna cut the circulation, and then because of that, then you might have the difficulty of using the arm because of the discomfort. And so, so that's what I'm saying is that when other people, when several of my clients, when they go to other clinic, and then they did not get good enough to get rid of that, and that's why they come to me, and hoping that I can help them to get rid of the possibility of doing the surgery. And that's why a lot of times people don't understand how the neck work, and then how can you protect your neck. Okay, so what I keep saying is that bring the chin down. Okay, pull back tiny bit. Okay, and so by doing so, you are going to protect your neck. So I'm going to do it in a sideways. So it's like bring the chin down and pull back. Okay, so in this position, and it's sort of like this. All right. So if your head is forward, then it's very easy to break. If you chin tuck and retract, then it's more likely to protect it. And then the joint, the intervertebral disc is going to be protected. Okay. Now, what about my experience? All right. So I took a long flight to other countries, and I come back. Then I realized that, there's a lot of soreness going on. I thought that maybe that's just the soreness itself. But the thing is that for the first I just stay there for one week and I come back. So basically, I spend 15 hours on one way and another 15 hours back. And what happened is that I could not use my neck freely. Every time I want to come back from the trip for the first 1 week, I always feel like if I want to do a little bit chin tuck and retract, I would say, ouch, oh, discomfort immediately happen. So what I have been doing is I give it a bit traction. So it's like this. Okay, so one hand over here, one hand of the chin, of the jaw, and then bring it up a little bit. Okay, like this. So when you do this, hold on, let me make it a bit light. Better. Yeah. Yeah. So it's like this. So when I push it up, then it will be able to bring your head up a little bit and retract. But that causes pain also. So, but I gradually bring this muscle back after 1 week of keep trying of bring this muscle, the deep neck flexors back, and I can do the rotation immediately without any discomfort. So that's my personal experience. So, and then recently I have another flight, maybe just 1 to 2 hours only. And then I started to observe how people are treating themselves, waiting for the airplane, right? So they either use a computer, right, or they use a phone. They might use the phone and try to or read newspaper, or they listen to the music and when they lay down. And notice that a lot of times they do not pay attention to a neck condition. So either they have to way forward and down, looking it down like this, and without holding it, retract and come back. Okay, can you see the difference here? This one in this position, it will be relatively good. So the neck is protected instead of all the way forward like this, or relax the upper part here. When you relax completely, then these muscles doesn't have a effort of pushing it back. Okay, and that get me thinking of what needs to be done to remind people of doing that. So my tips for today is to really put your hand like this and put it over your head like this. Okay, and then you can bring the chin down and pushing it back into your hand. Okay, like this. Yeah. Okay, so I'm going to put one hand so it'll be easy for you to see. So you can bring the chin down and pull it back like this. All right. And so that is much easier for you to have this retract, because that's how your body respond. If you give it a bit push forward, and then your neck is going to automatically pushing it back a little bit. Okay, and so that gives it a chance of the neck flexors and then the extensors a chance to work together. By doing so, it's easier for the neck to fight, and that is going to decrease the arthritis. Okay. So sometimes I got a question about like, what is arthritis and why? Arthritis is kind of a condition that you wear and tear, right? You wear out, but why? Why you wear out in specifically on one segment? The reason of that is because you are actually using the more on the cartilage to wear out of that and have more pressure into it. And the cartilage can take a lot of loading or kind of push it down, but it doesn't take a lot of the abrasion like this, kind of rubbing like this. It doesn't like those rotation along like this. Very easy, it will wear out. That's because it's like a piece of paper, right? So it's like I have some business card like this. So basically, it has kind of one layers, okay, several layers. So it's like this, right? So you have several layers of this, and that is similar to the cartilage. But think about this. Every time you let the pressure into it and you allow the abrasion, if you push it down, it probably will stay. But if you take it away, right, abrasion, so you wear and tear, so pull, because you have rubbing like this, so you pull away, and you pull away. Eventually, it's gonna get thinner, right? When it's got thinner, then the wear and tear, the intensity of that is going to be different in different locations. And because of each different location, so you'll be a little bit dip, a little bit down, a little bit higher. So it's kind of uneven. When you get to the point that it's uneven, what's going to happen is that when uneven surface is not going to glide smoothly. And what happened is like my hand here, instead of very smoothly like this, very smoothly like this. Let's put it that way. So you'll be very smoothly to glide. Then you'll be like this. So you'll be up and down. You can see how your fingers gliding. And so those up and down, it's what you might get catched. So when you rotate, it doesn't get going. So it doesn't go, it's stuck. When you force it, you might hear a little bit click. And that's what from a little bit a little bit swelling, a little bit pain, and then go away and get to a point that it's a bit stiff. It doesn't glide to the end range, and it's very smoothly. It's not very smoothly. And then if you get to a point that you feel a lot of popping, sometimes we call this crepitus. Now, when you get a lot of crepitus, that's a sign that that is actually going to get worse. And then the next step is that the arthritis is gonna the cartilage itself, like what I use my business card to demonstrate, then it will wear out. Eventually, the one side of the bone is going to hit the other side of the bone, so there's no cartilage to protect it. And so that sometimes your doctor might say it's pretty much bone on bone, and then that's the moment then you need to decide if you want to do the surgery to replace the joint or to really allow the doctor to remove all the cartilage and then fuse the joint. Okay, and that's not the case for the neck. I should say that that's not an ideal position because your neck need to be able to do a lot of rotation, a lot of movements, a lot of coordination things with your eye, with your neck, or with your hand, right? But if that doesn't happen, then your life will be very much limited. Okay. Yes. Now, the another thing here I want to share with you is the strategy that based on the popping. So you might have some pain, but it went away with time in the past, or you have some maybe you have some crepitors, like a popping, or you have like stiffness, it doesn't go. And another thing I want to point out is that a lot of times our neck discomfort is actually strongly associated with the shoulder or I should say also include the upper back. Okay, and so that's because the upper back, as you can see that I have pictures over here with anatomy of the human body. So it tells you how the muscles and connected from the neck to our shoulder. For example, our upper trapezius muscle, and the upper trapezius muscles is a very important one. If you have that overused, and that's the trouble. So I have this patient with the surgery on the shoulder with rotator cuff, and then also some condition over this area, surgery on this area. What happened here is that after she had a surgery on the shoulder first, then the surgery here. Now, with the surgery itself, the shoulder recovered okay, but then it's not okay for the upper muscles, upper trapezius muscles, or the muscle connected from neck to shoulder. So what happened is that when that's about 5 weeks ago, when I put my fingers here, try to check this muscle, just gently touch the muscle, literally jumped, and I get into a spasm like that. So some muscles like this don't want to go. So need to push very hard and then allow the muscle to relax. Now after 5 visits, the muscle spasm decrease. So today, when I palpate the upper trapezius muscles there, it's only one time only that the muscle kind of jump a little bit and then just come down. Now, what happened today here is that I also use a technique we call the dry needling, which is the needle directly, the acupuncture needle directly to the muscles of upper back, and which is pretty much right here. Side here, upper back. But when I go to the attachment on the selected side here, and the attachment on the scale bone, which is the shoulder blade, or what we call the scapular bone. Now, after that, when I palpate it here, it's completely solved. When I palpate it, there's no jumping of the muscle at all. Okay, so and then for this case, in only 5 visits, significant improvement there, tolerance, able to do more instead of overuse. Understand to control the neck in a neutral position and then shoulder down and back when you do things. And that's a habit. So it's not a truly weakness going on. It's actually more than that, right? It's more than that. Okay. All right. Very good. So today's topic is about how to maintain in a healthy neck and avoid arthritis. All right. And if you have any questions, you can let me know, and I will lift the my contact information. And if you have anything that you like to address, and then you can always contact me or go to my website. Okay, thank you. Bye.